Novant Health will reopen its physician offices on Monday. That means doctors will see more patients for things like annual checkups. But even though we are making steps to return to normal, things will not be the same. WBTV's On Your Side health reporter Christy O'Connor joins us now live to break down what you can expect if you do need to go to the doctor's office. Christy?
Yeah, Maureen, this is sort of our new normal, so I guess we should get used to it. These are some of the changes that you can expect. If you are going to the doctor at Novant Health anytime soon, make sure you're wearing a cloth mask before you go into the building. And if you don't have one, then Novant will provide you with one. All of their employees, as well as all of the patients in the facility, will be wearing masks during that visit. In addition, you will notice that there's going to be less furniture in the seating and waiting room, that is, and the furniture that is still there will be separated by about 6 feet. They are sanitizing the chairs in between each use. If you see a green ribbon on that chair, then you know it has been sanitized since the last person who sat in it, so you are clear to use that chair. You also won't be seeing the magazines on the coffee tables, as well as the clipboards and pens that we often shared to fill out that paperwork in the waiting room. Now, Dr. Browning, who I spoke with, or Browning rather, said that you should not be concerned with coming into contact with a patient who has coronavirus or is suspected of having coronavirus, because those patients will not be treated in these offices.
It's really important that we try to keep all of those patients at a single location. We're sending them to our respiratory assessment centers so that everyone else can feel comfortable being back in the office.
And it's unclear just how long these measures will last for. Novant Health says they will be monitoring our local data and make decisions on how long they need to keep going on with these precautionary measures, or if they can move forward and reduce some of these measures that they are taking. Maureen?
And Christy, at the very beginning of the pandemic, they also cut back all elective procedures. Are they allowed to have some of those now?
Yes, again on Monday, some of those will be reinstated. At the time, Novant Health postponed about 6,500 elective surgical procedures, so nothing that would require an emergency, but things that safely could be postponed. And while that delay was going on, the hospital system had enough time to secure enough personal protective equipment, hospital space, so that they could separate patients, as well as making sure there was enough tests available to test patients before they got that surgery done.
That we now are able to test every single patient before surgery. So anybody who's going to come into our facility for surgery will have, testing done, so we know that they don't have coronavirus.
And of course, before employees report to work every shift, they are being screened for coronavirus symptoms. Reporting live in Charlotte, I'm Christy O'Connor, WBTV, On Your Side.
All of these developments today, Christy, sort of feeling like a little bit closer to a step to things getting back to somewhat normal. Thank you.